Next, after we decide what's most important, we are going to then move on to our second piece, which is going to be analyzing those cues or figuring out what they could mean. And so I want to take a second and remind you guys that we do have cheat sheets available, and Dr. Courtney is going to leave a link for you to access some of the cheat sheets that we have available for free. But these are going to focus on a lot of these tough topics. And when we're talking about step 2, analyzing cues, that really requires you to have an understanding of the disease process or to know your content. But when we're thinking about analyzing cues, the NCLEX wants to know that you know what those cues could mean. And they might ask, what conditions is the client experiencing or at risk for, what disease processes could cause those findings, or how you would know if this or that condition was happening. And so the important thing here to consider is the big picture problem, because in our example, we know that shortness of breath could mean a ton of things, right? It could be from pneumonia, it could be from heart failure, it could be from collapsed alveoli like an atelectasis. And so we have to consider the big picture. We already decided in step 1 that we're most worried about his difficulty breathing, right? And probably several of you said there's too much fluid on him, and I agree. So we're going to be thinking about what crackles are caused by in this patient. So the nurse recognizes that crackles throughout the lungs in this client are due to either infective infiltrate, collapsed alveoli, or fluid accumulation that's related to either pneumonia, heart failure, or reduced mobility. So we have to kind of zoom out and think about all of our cues here. And I've got some guesses starting to come in. Vanessa says fluid accumulation and pneumonia. Claudine says fluid accumulation and heart failure. So we have some agreement that we're worried about fluid, and I'm going to give that one to you guys because you're right. We've got an S3 present. We've got pitting edema. We can see and hear that this patient has too much fluid. So that is likely our issue, fluid accumulation. But then from what? We need to think, is this from pneumonia, heart failure, or reduced mobility? And any of these things, I'll say, could cause crackles, but there's only one that's most likely in this client. And so let's look at some of these in order. So pneumonia. So if somebody has respiratory difficulty from pneumonia, what other symptoms might tell us that? Think like vital signs, lab values, assessment findings. So if somebody has pneumonia, which is an infection, it would cause crackles, right? Because I would have pus or infective infiltrate building up in the alveoli, but I would also have findings of infection, like Temwa says temperature. Yes, I might have a fever. Maybe he's got chills. So right, if we had pneumonia, we would maybe see some signs of infection like muscle aches, weakness, anorexia, other things like that. But heart failure, I think you guys are onto something, and the majority of you are guessing that because yes, we've got all this heart failure risk factors present. It's worse when he's laying flat, right? That's called orthopnea, why he's having to sit upright. And if we look, we're going to do a quick review of this. Whenever you've got heart failure from inadequate blood supply to the heart muscle, like in coronary artery disease, and maybe too much oxygen demand on the heart, like if you have hypertension and the heart's having to work really hard to pump against that high blood pressure. So those things are going to strain the ventricles, cause them to weaken, and then we've got two problems. Instead of the blood moving forward to the organs, it goes backwards into the lungs and it builds up, and then the alveoli can fill with fluid. And so that's actually what you're hearing when you're listening to crackles. And if you guys have never had a chance to actually listen to this on a patient, you can take a little bit of your hair and kind of roll it between your fingers here, right by your ear, and that's pretty close to what crackles sounds like. It's described to me as like a snap, crackle, pop, or Rice Krispies sounding noise. And I like to think of this like we're trying to blow bubbles through a straw, or we're trying to get oxygen in and carbon dioxide out, but it's going through fluid, like blowing bubbles through a straw. So that's kind of what you're hearing there. So good, fluid accumulation related to heart failure. You guys are right. But let's consider the others. So several of you thought maybe pneumonia. totally a good guess, really good guess, but we didn't have those signs of infection. He didn't have a fever. We had a completely normal temperature, so less likely. Also, he might have told us that he's coughing up like tan or green yellow sputum, and we didn't have anything about that. Then our other option, reduced mobility, which would be most likely to cause collapsed alveoli. So that would be crackles due to atelectasis, where somebody who's had prolonged immobility, which he's really not been getting up very much, then that instead of taking deep breaths, you take these shallow breaths and the alveoli start to kind of collapse. And then you'd hear crackles when they take a deep breath and it opens them up. But those tend to clear with coughing, and he's been coughing for 2 days and they haven't cleared. And we just have so many other signs pointing toward fluid overload, which, remember, we got fluid that backs up because it's not moving forward to our organs, especially our kidneys, so we retain it. And we are correct. And remember, if you're ever confused about anything in these case studies, you can come down here and watch these video explanations and read our written explanations as well.